Hi, my name is Lindsey Hennigar, and I'm a certified pediatric sleep coach. I'm founder of the Sleep Ranch, and I'm excited to be partnering with Evalure to bring tips and some awareness to sudden infant death syndrome. SIDS stands for Sudden Infant Death Syndrome, and what it is what happens when a baby dies unexpectedly in their sleep. Approximately 3,500 infants die annually in the United States alone from sleep-related deaths. These deaths include SIDS, ill-defined deaths, and accidental strangulation and suffocation that occurs in a bed. There's a category of babies that are intrinsically more vulnerable to experience SIDS. This category includes babies who are born prematurely, with a lower birth weight, and who are exposed to illicit drugs and tobacco while in utero. Something really important that I want you to know about SIDS is there is no product that you can buy that prevents SIDS. And I think it is horrible that these products are actually advertised as a product you can use to help prevent SIDS. And there is no product out there that can prevent SIDS. So even though a product says it can prevent SIDS, there are no products out there that actually prevent the risk of SIDS. However, there are things that we can do as parents to reduce the risk of SIDS. So there are things that parents and caregivers can do to reduce the risk of SIDS. This is according to the American Academy of Pediatrics, and they recommend following safe sleep guidelines for at least the first 12 months of your baby's life. As once your baby turns 12 months, the risk of SIDS is now gone. So the first three things are the ABCs of safe sleep. These stand for baby is alone on their back in their crib. We don't want anything in your child's crib under the age of 12 months. So no bumper pads, no DockATots, no pillows, nothing in your child's crib for their first year of life. There are a few other things that have been proven to reduce the risk of SIDS. So the American Academy of Pediatrics recommend parents room share, which is different than bed sharing, but room share with their babies until 6 months. Ideally 12 months, but minimum 6 months has been proven to reduce the risk of SIDS. Placing baby on their back, making sure the room isn't too warm can also help reduce the risk because we don't want our babies to become too warm and overheating. Once your baby starts showing signs of rolling, if you are swaddling, we then need to take them out of their swaddle. A few other things that I want to share is there have been some studies that have shown that using a fan in your baby's room has helped reduce the risk of SIDS by up to 72%. Which is a really, really big number. So I hope that information was helpful and provided some insight on safe sleep. It's something very near and dear to my heart. So please, please, please follow safe sleep. Our little babies are so precious. And like I said, there's just these little things that we can do to provide them a safe sleep environment that could potentially be life-saving.